So, if you look at Fiona, what age are you, Fiona?
54.
Okay, so she came in about 2-3 years ago here. Yeah. And I said to her, oh, and she said, Tracey, I hate the wrinkles under my eyes and all these on the top. Yeah. And I said to her, Fiona, you need to have a blepharoplasty. She went, my Botox isn't working. I get a face full of Botox and it's not working. She was really, really overfilled mid-face. And I had to convince her, because Fiona knows the stuff as well, I couldn't put any more filler in. And me and Megan kept sending her off. I did some Botox and she come back again and she said, no, I want you to lift it more. And I said, I can't lift it more. You need to have surgery. And so, was it last year?
Yeah.
Last year she went and had an upper bleph. So now we're all really happy because, we'll get Fiona's, so she basically had, there's a great guy called Austin McCormack that is in Liverpool, and he does the procedure just purely day case under local anaesthetic, and he cut all this excess skin out and she had lots. So that means now I can make her forehead nice and smooth, yeah, because she hasn't got that excess skin there. Then what we did a little bit of cheek filler, CK1, CK2, a little bit of jaw refinement, yeah, and then that's really been it, yeah. And then she came back in and she went, right, what do I need? And she came with a book. Should I have Cool Mini first? Should I have all therapy first? Do I need a chin? Yeah, I said, oh, you need everything, yeah. Then she went back down to Megan, and then she asked Wendy, then she asked Lisa, and she went, but what do I have first? And I said, look, the thing is you need all the procedures, yeah? But you've got to do it over a period of time. So, let's look at Fiona from the side and from the front. If we look at her from the side, she is a classic, yeah, English, yeah, retrograde chin. When they have a retrograde chin, they get all this submental fat, yeah, and as we age, it gets, you're class 1, yeah, yeah, but she's class 2, and if you look at the nose to the chin, we're miles out, and people like this to be in line. So, what I've said to Fiona, Megan is going to do 2 sessions of Cool Mini. So Cool Mini again is owned by Allergan. It is a machine that we probably had 6 years, yeah. It was just originally one big applicator, and then what happened was Allergan bought it. And we can use it everywhere, and it shrinks everybody, yeah. So Cool Mini is an applicator that we put underneath the chin, and it will reduce this submental fat. Now anybody that's clever will say, oh, but doesn't that leave all the excess skin? No, it won't, because what happens is when you get retraction of the fat pad, the fascia is attached and that goes back as well. If you look, she's got this beautiful defined nose, she's got these nice cheeks, and then we get to the bottom. And no one's ever thought of doing her chin. So what I said to Fiona is, Fiona, have a 3D scan. Off you go and we will start to rebuild your chin. So I'm going to cross the modulus here and I'm going to rebuild the chin, and we'll do one side, sit her up, and I'm going to use a product called Volux. So this is the relatively new product. It lasts anything from 24 to probably 2.5 years really. And again, long term, we might end up putting over a period of 2 years, maybe 4 mil in that area. But for the first time, I'm going to put 2 mil. And then we'll leave that probably for about 4 to 6 weeks. And then what we're going to do mid-face, so she wants this. And I said, I can't put, smile for me, Fiona. Yeah. So that looks much better than what it used to look. Because what used to happen was she had filler really high up, didn't you feel?
Yeah.
Really, really high up underneath her eyes. So when you looked at her, you couldn't help but look because you were trying to work out what was different. So we've just stopped putting filler in. I said, I can't take it out because you won't be happy. But what we'll do is we'll add it further back here. So long term, 4 to 6 weeks, I'm going to do a product called All Therapy. So we'll just tighten everything. And she will be far happier than that. And then maintenance, so she'll probably see her once or twice a year. She'll have a little bit of filler in different areas. She might not, yeah. But your treatment needs, because you used to just have Botox and fillers, didn't you? Yeah. So again, you know, it's educating your patient and it's always trust. And then Fiona had some dental work done, then the teeth had moved slightly, yeah.
Lost new retainer.
Yeah, then she was never really happy, were you, with the dental work that you'd had done
No.
when they straightened her teeth about 10 years ago?
Yeah.
Because what they really should have done is explain to her what she was going to get. So if you look at Fiona, I want you to bite together for me, and I want you to show them their teeth, back teeth. Can you see the big overjet that she's got? And that's her whole problem facially. If she could, so watch this. Bite together on your back teeth for me. Right, with your teeth together, I want you to slide forward onto your front ones. Look what happens. Now, that's what Angelina Jolie has had. So if you look at her images of when she was sort of 18, 19, and you think, why does she look more defined? It's because they've built her lower face. So again, slide again, back teeth, look at the difference, can you see? So what I'm going to do is I'm going to build with Volux this lower area today. So, hold, and again, we come down, first one in. You okay? Okay. Perfect. Okay?
Yeah.
Right, let me see. So here, I'm going to push through, and she'll feel it just as it crosses here. Yeah? You okay? And here. So what we're going to do here, we're going to pull back, and there is a little bit of anaesthetic in this, so this will start to feel numb. You okay?
Yeah.
Perfect. Can you see? And again. You know, we did this day because Allergan had asked us. We've got an event in Liverpool as well. But any of these treatments, if you're unsure, come in. We've got loads of patients that will let you watch an IPL, watch an therapy treatment. All you need to do is ask Meg or people that have had treatment. And some, obviously we can't put them on the internet, but you know, we've got lots of fantastic patients that will speak to you. You okay? Perfect. So I'm just working halfway here. Across and up. That's a 4 mil.
Fiona, you okay?
Okay. Load that onto the other one.
Deep breaths in.
You okay, Fiona? Okay, and then what I want you to do, Fiona, I want you to look at me. Okay, and relax. So again, I go into this point here. I go onto bone. You okay? And this gives length. So remember, it's like a tissue expander. Okay, how do you feel?
Alright.
Okay, next. Put my cannula back on for me, Sonny. Okay. You okay? So again, in, retract. Rinsing before I've even done anything yet.
Really?
So again, we'll feel this down here and we retract back. And this is brilliant as well for resurfacing, you know, the top thing. She's got a big sort of dint in here. So again, long term would fill mid-surface. So this tomorrow will feel very firm. Disappear probably by Sunday, nobody will notice. And again, longevity of result, probably 2 to 2.5 years. And it's really, really good in the corner of your mouth, because marionette lines, if anybody's ever had a filler here, it's very difficult to get a fantastic result by just treating marionette with one of the other products. You need a thicker filler. So she won't be able to feel this when it's integrated. When you first inject at the corner of the mouth, you can always feel it. And I say to the patient, you know, that's completely normal, nothing to worry about for the next, do you know what I mean, 4 weeks, and then it will disappear. See it, same as when you do cheeks. If you've got a younger patient and they come in and they have cheeks, they might come back. So for example, if I picked on Cindy, and I said to Cindy, right, if we're going to do a little bit back here, you will be able to feel that from 4 to 6 weeks, then it disappears, because it integrates into the dermis. Okay, you all right? Okay, does that feel numb at all?
Yeah.
Yeah, so that's the thing, it feels numb, you know, so some people again get a little bit panicked and they start thinking, oh, I can feel that. This product you've really got 24 to 36 hours to mould, so you've got to mould it, yeah? And you'd say to the patient, do not touch it. If you look, all we're doing is trying to extend this, yeah? Here at the side, yeah? Okay? So it's not, so people wouldn't know to go out and notice, she'll notice.